dirty. We're not like pausing to do hand hygiene or anything like that. If you get to get gloves on, yay, woohoo! Rolling the sides of the bag down. You dump. You separate. Hopefully I don't need that stuff. Open up the bag with your trach in it. I'm gonna check my cuff. Deflate my cuff, one thumb on the obturator, fingers over the cuff. Some people, you know, if they're looking at two different things, they do this. So just be careful that you're not occluding at the pilot balloon. So pulling back while you're pull back on the plunger while you're pulling back on the cuff so that you're pulling back the edges of the cuff in a nice manner. Lube your tube. You have your inner cannula within reach. Push your plunger down, coming over to your patient, deflating your cuff. Undo the trach tie. It's an out with a downward motion. 2 thumbs on the obturator, holding the flange, in and down. Holding the flange now, because that's the only thing keeping that trach in. Obturator's out, inner cannula's in. Kind of like a seatbelt, make it click. Connect your ambu and give a breath. How often do we give the breath for the adult? Every 5 seconds. May need to hyperventilate them a little bit in the beginning. And then I don't disconnect my ambu until I get my vent tubing disconnected, because again, then if you need to use a wedge and now you've already disconnected your ambu, disconnect, connect them on there. I'm gonna do my trach ties. Making sure that that Velcro's not right up against the skin. Not more than 1 finger breath there. Then I'm going to use my stethoscope and do my minimal leak technique. It's like sticking up. So if the order is between 4 and 6 mLs, I'm going to pull the syringe back all the way to 6. Put my ears in. I'll instill the minimum, which is 4, so that would bring my syringe to 2. And if I'm still hearing the whoosh, go another half, whoosh, go another half, go another half. I hear nothing, but I want a minimal leak so that I know that my cuff's not overinflated and damaging that delicate tracheal tissue. So I'll pull back by a 1/2 ml until I hear that slight hissing sound again, so I know that there's a minimal leak. And I'm holding the plunger there the whole time. That way the pressure that's on the cuff inside the trach isn't pushing my syringe back any further. Disconnect. I would document emergency trach change done due to suspected mucus plug. Cuff inflated with 5 mLs using minimal leak technique. Patient's now pink. SAT's 97%. He's back on the vent. And then I would get my next emergency trach kit ready.
If this is a scheduled trach change, do you suction before you take out the trach tube?
Yeah, because when you deflate the cuff, all those secretions are going to fall down there. So yeah. And you would coordinate it with the person that you're doing it with. So you would say, okay, you're going to take out the trach, I'll put in the new trach. You both do hand hygiene. You have your gloves on. Deflate the cuff, suction. What did I say you were doing? You were taking out or putting in? I don't remember. Oh, okay. So you would take out the old trach, and I'd be ready to go with the new trach. You take it out, I'd pop it in. Still, I'm holding on to it, obturator out, inner cannula in, bag them, get them pink again. And then as the second person, I could hold the flange, the trach flange, while you secure the ties using 2 hands. and then still doing minimal leak technique.